Hi everyone, Dr. Fraser here. Today I want to talk about something important for all of us, focused on living longer and healthier, that is catching cancer early. Early detection can make a huge difference in outcomes. But right now, only about 30% of cancers have a standard screening test, such as a mammogram, colonoscopy, skin exam, and so forth. And even all of those tests are far from being perfect. In our practice, we already do yearly labs, a full body MRI, and more recently, low dose chest CT, given that lung cancer is still the most common cause of cancer death, even in non smokers, to spot these things early. To make our approach even stronger, we're now wanting our patients to consider adding a simple blood test called a liquid biopsy. Common options include Galleri from Grail or EpiSeek. These tests look for tiny signs of cancer in your blood that other methods might miss. In this video, I'll answer the most common questions about why we're adding them and how to fit them into your plan.
What are these liquid blood biopsies and how do they work?
They're easy blood draws that check for molecular signals from cancer cells. Galleri uses advanced technology to spot DNA shed by tumors and can signal over 50 types of cancer, including many that do not have routine screening tests available. EpiSeek looks at changes in how DNA is marked through epigenetic signals that point to early cancer. They're not for diagnosis on their own. They act like an early warning system to prompt more targeted checks if something shows up, often before you feel any symptoms.
Why add this if we already do MRI, CT chest, and labs?
Our current setup is solid, but no single tool catches everything. The MRI is great for seeing structural changes in many areas, but it can miss very early or tiny cancers, especially in places like the lung, pancreas, or colon. These blood tests add a different layer by picking up molecular clues that imaging doesn't see. This is for the 70% of cancers without good routine screens. This gives us extra protection and peace of mind.
What if the blood tests flag something like pancreatic cancer, but the MRI looks clear?
This happens sometimes, and it's actually helpful. Our whole body MRI is pretty good at spotting many issues early, often down to small sizes. But for example, with pancreas lesions, they can be hard to see, as early pancreatic cancer is seen better on a dedicated MRI of the pancreas with IV contrast. If the blood test were to raise a concern, but the MRI was negative, depending upon the finding, we would first ask the radiologist to take a closer look at the images. And then with that in mind, we may choose to get a more detailed focus scan on the area of interest. We might repeat the MRI in a few months rather than waiting for a full year, for example. It's smart, proactive monitoring without rushing into unnecessary procedures.
How about for lungs or colon if the blood test is positive, but the MRI is negative?
This is where these tests can really shine. MRI isn't the best for lung or colon changes. If Galleri signals something there, we'd move quickly, such as getting a low-dose lung CT or colonoscopy. This could catch things at a treatable stage that our routine checks might have overlooked.
Are there downsides like false positives?
Absolutely, no test is perfect. However, Galleri has a very high accuracy, around 99.6% specificity, meaning false positives are rare, only about 0.4%. Still, a positive result might lead to extra tests, some anxiety, or added costs. We handle this carefully in our practice by looking at the full picture, your history, labs, MRI, and only acting when it makes sense. False negatives can happen too, so we never rely on just one tool. The benefits for spotting hard to find cancers usually outweigh the small risks, and it's just a quick blood draw.
How often should we do these, and do they replace anything?
We suggest doing them once a year, right alongside your MRI, chest CT, and labs. They don't replace anything, they build on what we're already doing for better coverage. We can adjust based on your personal risks like family history, but yearly is a great starting point for most.
What's the evidence behind this in longevity care?
Studies like Grail's Pathfinder trials show these tests can find cancers missed by standard screens, often at earlier stages. For those of us aiming for maximum health span, adding this fits perfectly with a proactive layered strategy. It's not yet routine for everyone, but in forward-thinking practices like ours, the growing real-world data makes this a smart addition. To wrap this up, cancer screening isn't one tool. It's about stacking the best ones. With only 30% of cancers having solid routine screening tests, adding liquid biopsy like Galleri or EpiSeek gives us molecular level insights that complement your annual MRI, chest CT, and labs. It helps us act earlier on tricky spots like pancreas, lungs, or colon, all to support your longevity goals. If this sounds like something you'd like to explore or add to your plan, schedule an appointment, and we're happy to discuss. Thanks for watching. Until next time, stay healthy, active, and safe.